Childhood-onset fluency disorder, commonly known as stuttering, is a speech disorder. It disrupts the normal flow of speech. Children with this disorder may repeat sounds, syllables, or words. They might also prolong sounds or experience blocks in speech. This condition can cause distress and affect communication. Stuttering often begins between the ages of 2 and 6. It can vary in severity. Some children may outgrow it, while others may continue to stutter into adulthood. Early detection and intervention are crucial. Understanding the nature of this disorder helps in providing the right support. The disorder can impact social interactions and self-esteem. Children might feel frustrated or embarrassed. It is important to approach the issue with sensitivity. Effective communication strategies can help manage the condition. Understanding stuttering involves recognizing its signs and symptoms. This knowledge can lead to better support for affected children. In the following sections, we will explore these aspects in detail. Stuttering manifests in various ways. The most common sign is the repetition of sounds or syllables. For example, a child might say ball instead of ball. Prolongation of sounds is another symptom. A child could stretch a sound such as snake for snake. Blocks or pauses in speech are also noticeable. A child might get stuck and be unable to produce any sound for a few moments. These blocks can be accompanied by physical signs. Children might blink rapidly, tap their feet, or exhibit facial tension. Secondary behaviors often develop. These include avoiding certain words or situations. For instance, a child may avoid saying their name if it triggers stuttering. This avoidance can limit their participation in social or educational activities. Parents and teachers should observe these signs closely. Early identification allows for timely intervention. Encouraging a supportive environment can reduce the child's anxiety about speaking. Next, we delve into the causes and risk factors associated with stuttering. The exact cause of stuttering is not fully understood. However, research suggests a combination of genetic and environmental factors. Family history plays a significant role. Children with relatives who stutter are more likely to develop the disorder. Neurological factors also contribute. Brain imaging studies show differences in the speech areas of the brain in people who stutter. These differences can affect the timing and coordination required for fluent speech. Developmental factors are important too. Rapid language development in early childhood can sometimes lead to stuttering. Children may struggle to keep up with the pace of their thoughts. This disparity can cause disruptions in speech fluency. Environmental factors such as family dynamics and stress can exacerbate stuttering. High expectations and fast-paced conversations can increase pressure on the child. Providing a calm and supportive environment is beneficial. Understanding these causes helps in addressing the disorder effectively. It is important to approach treatment holistically, taking all these factors into account. In the next section, we will look at the various treatment options available. Several treatment options are available for stuttering. Speech therapy is the most common approach. An SLP works with the child to improve fluency. Techniques include slow speech and controlled breathing. CBT can also be beneficial. It helps manage the emotional aspects of stuttering. Electronic devices alter the way the child hears their own voice. Parental involvement is crucial. They provide a slow speech model and reinforce positive experiences. Effective treatment requires a tailored approach. Managing stuttering speech therapy and beyond. Speech therapy is a cornerstone of stuttering management. Regular sessions with a speech-language pathologist or SLP can lead to significant improvements. Creating a supportive environment at home and school is essential. Teachers play a critical role. They should be informed and trained in supportive strategies. Allowing extra time to speak and being patient can make a big difference. Peer support is another valuable resource. Encouraging classmates to be understanding can reduce anxiety. Technology can also assist in managing stuttering. Apps that provide speech exercises and feedback can be beneficial. Combining these strategies creates a comprehensive management plan. Coping strategies for children with stuttering. Coping strategies help children manage their stuttering in daily life. One effective technique is easy onset. This involves starting speech gently to reduce tension. Practicing this technique regularly can improve fluency over time. Another strategy is voluntary stuttering. This involves intentionally stuttering on words. It helps reduce fear and anxiety associated with stuttering. Over time, the child becomes more comfortable with their speech patterns. Relaxation techniques can also be effective. Deep breathing exercises and mindfulness can reduce overall anxiety. These techniques help the child remain calm and focused during speaking situations. Regular practice can lead to better speech control. Positive self-talk is crucial. Encouraging the child to use affirmations can boost their confidence. Phrases like "I can speak clearly" or "I am in control" can reinforce positive thinking. Parents and teachers should also reinforce these messages. Implementing these strategies requires patience and practice. Consistent support from adults is key to the child's success. In the next section, we will discuss how families can provide this support effectively. Support for families dealing with childhood stuttering. Families play a vital role in supporting a child with stuttering. Open communication is essential. Create a safe space for the child to express their thoughts and feelings. Listening without interruption shows respect and patience. Educate family members about stuttering. Understanding reduces misconceptions and fosters empathy. Attend support groups or workshops for insights and coping strategies. Involve siblings in the support process. Participate in speech exercises as a family. This strengthens the support network. Maintain a positive and encouraging attitude. Celebrate small successes to boost morale. Supporting a child with stuttering is a collective effort. It requires consistency, understanding, and patience. Please subscribe to our channel for more informative content on childhood disorders and treatments.